What is the typical profile of a patient you would recommend for a coronary artery scan?
Well, I think there are two groups of patients that I see coming into my office where the coronary artery scan would be extremely helpful. One would be the asymptomatic individual, male over the age of 40, who has one or two other risk factors. Maybe he's hypertensive, maybe he's smoked, maybe he has a family history, maybe there's some diabetes in him or his family, who is asymptomatic but wants to start an exercise program, and more importantly, wants to know what his outcome is going to be and how vigorously he needs to work on other risk factors. That patient would be very helpful to have a scan to know the status of his coronary arteries. The second patient would be the patient that comes in with some type of symptom. Atypical symptoms, not your typical angina symptoms. Again, with or without risk factors. In that patient, a negative scan would tell me that those symptoms are not coming from coronary artery disease.
There are really two groups that I'm using it extensively in. The first group is the individual who comes who has some symptoms that may be suggestive of angina, of heart pain, but in whom, based on my clinical evaluation, assessment of their risk factors and the like, really puts them in a very low risk of coronary disease. It's that group that I perform coronary scanning in, mainly for the hope or the expectation that the test will be negative. Because I know that for a negative test, it's 95 or greater % negative predictive value for the presence of obstructive disease. If that patient has no disease, and again, based on my clinical evaluation, I suspected that, then I go on to evaluate this chest pain or the like, looking at other potential causes. The other group that I look at, and the group that I think is probably the most likely largest group of the population that will be of benefit, is the individuals who have 2 or more conventional cardiovascular risk factors, and in whom I'm evaluating them for making decisions about what to do next. I'll do the coronary scanning on them, and in fact, if I find the presence of mild to moderate coronary plaque, then I'm extremely aggressive about modifying their risk factors.